Today we're going to review and demo how to take an accurate blood pressure reading at home, along with a few important safety and technique considerations. This is important because even small errors in technique can change your readings. Before we start, let's talk about when not to use a certain arm. You should avoid using an arm with a dialysis access like an AV fistula or graft, a history of lymph node removal such as after breast cancer surgery, an arm with lymphedema or swelling, a recent surgery or injury including pain, stitches, or fracture. If you have IV lines, PICC lines, or active intravenous infusions, or if you have paralysis or significant weakness after stroke or neurological injury. If both arms are affected, your provider may be able to recommend using a leg. You can consult with your provider if that is the case. And if there are no restrictions, let's proceed. When you first start checking blood pressure at home, check both arms and then use the arm that gives the higher reading for future measurements. After that, stick with the same arm every time. A small difference between arms is normal, but if one arm is consistently higher by about 10 to 15 points or more, let your healthcare provider know. Before you check your blood pressure, avoid caffeine, smoking, or exercise for at least 30 minutes. Also, empty your bladder if needed. These small things can affect your readings more than people realize. Now we're ready to take a blood pressure reading. Body position matters as well. Sit in a chair if possible. Keep your feet flat on the floor and avoid crossing your legs. That's a hard one for me, and I have to remind myself to uncross my legs. Rest your arm on a table if possible so that it's at heart level. Stay relaxed but still, and don't talk during the measurement. The best method is using an upper arm cuff, the kind that wraps around your arm with Velcro and inflates automatically. So I have this kind right here. It's kind of like an all-in-one where you press the button while it's on your arm. There are others that are similar to this, but they have tubing that goes from the cuff down to a little tabletop monitor about this size, and you press a button on that little monitor that sits on the table. Both are great. Be sure to use the correct cuff size because too small of a cuff can equal falsely high readings, and too large of a cuff can equal falsely low readings. All right, let me demonstrate. So place the cuff on bare skin about 1 inch above the bend of the elbow. So I'm going to do that right now, and then I'm going to secure my Velcro. Now mine has a dot right here that lines up with where you bend your elbow, and right in the middle of that bend. So I have this about 1 inch above where my arm bends. I have the dot in the correct position. All right. If you have the type that has the monitor that sits on the tabletop, there's going to be the tubing that's going to run down the inner part of your elbow. The cuff should feel snug, but not tight. Like I can fit at least 1 finger inside. Keep your arm supported on a table or, at heart level. If you don't have a table, I know at the doctor's office they usually hold it, but if you can sit at a table, that's pretty good support. Try to get it as close to heart level as possible. All right, so this is very important. Do not talk or move during the measurement. All right, here we go. I'm going to be silent now, and I'm going to press the start button.
A few minutes later.
All right, looks like it's done here, and it says 122 over 73 with a 70 pulse. All right, so I would write that down in my log. All right. Remember, this is just an example for demonstration purposes. Please don't compare your numbers to mine. The right blood pressure goal can vary from person to person, so always follow the target recommended by your healthcare provider. For those who want to know, systolic, or the first number, is the pressure when your heart squeezes. And the second number in the reading is the diastolic, and that is the pressure when the heart relaxes. The third number is the pulse, and that's how many times the heart beats per minute. Now, before we finish, I also want to briefly talk about wrist blood pressure cuffs. Upper arm cuffs are still the preferred and more accurate method, but I understand that some people may already own a wrist cuff or may find them easier to use in their particular circumstances. So let's quickly review a few important things to know if you're using a wrist blood pressure cuff. The main issues are that they're very position sensitive. The wrist must be at heart level, and even small changes in position can cause false readings. They're also more affected by movement. And the arteries in the wrist are smaller, which makes readings less reliable. For this particular wrist cuff that I have, the instructions say to put it on the wrist palm size up with 1 centimeter from the bend of the wrist. So I'm going to do that now. So I got palm side up, and I'm about 1 centimeter from, and I've got Velcro again. And I'm going to hold the wrist at heart level, and I want to keep the wrist straight, not like really bent. Okay, and you don't want to hold your arm out straight, and you don't want to collapse it over either. But read your instructions. This particular one is that way. And then I'm going to keep it at about heart level. And I'm going to stay still and don't talk. Another thing you can do is take a few readings to confirm that it's, pretty consistent readings with the wrist. All right, let me demonstrate. So I'm going to press start and be silent.
More minutes later.
All right, so this one, this time gave me a little bit lower reading than the upper arm cuff. I'm at 118 over 68 with a 72 pulse, so that's a little bit lower. I'm not sure I totally trust that reading. Who's to say which one's right, but I do tend to probably agree with this one a little bit more since it's going on a larger artery, so to get the reading. So yeah, you can always take it in and compare it with at the doctor's office. Okay, so now I want to write down the reading of whatever I got. So thank you for watching, and I hope this helps make blood pressure checking at home feel easier. Take care, and I'll see you in the next video.